Assalamu alaikum wa rahmatullahi wa barakatuh. Very good evening and welcome to another edition of your health and wellness show. I'm Khawa Solomon. Stay with me as we inform you in the world of dentistry post COVID for the next hour. Stay with us. If your family and friends wants to join us live, please watch in via www.hilaal.tv and you can live stream wherever you are over the beautiful seas and across the mountains. So I'm Kawa Solomon, and remember, you can always catch our uploads the next day after the show on our YouTube Hilaal TV. And do send your comments, questions, and queries for any of your dentistry, health, and wellness comments to our WhatsApp and our email address. And you can also follow us on our various social pages. So today, as I mentioned, post-COVID in the world of dentistry, we have our local dentist in studio with us, Dr. Fahima Ismail, and very pleased to say that she's quite a social buff. So you'll see her all over social media as well, and that's how we found her. But let's get more into Dr. Fahima before anything else. Assalamu alaikum, Dr. Fahima. How are you doing?
Walaikum salam. I'm fine, thanks, in yourself.
Shukr alhamdulillah. Thank you so much for joining us and taking some time out. And thanks to load shedding, you happen to be available today.
Yes, and it's been so crazy.
Yeah, so
because we just
load
have
shedding
to-
kind of helped us in this way,
Yes.
but it hasn't been great in some instances. So alhamdulillah for having you here today, and we're very excited actually to talk about dentistry, as it's been a lot of the medical aspects, like dentistry, like orthodontics, even some serious cases people had to just put on hold because of post-COVID. But before we talk post-COVID, quickly tell us a bit about yourself, Dr. Fahima. As I mentioned, you are a social buff, and that's how we found you. Why do you find that, I mean, alhamdulillah, you've used social media in a way to promote dentistry, because there's always this fear and anxiety around it, which we'll talk about a little bit later on. So just talk about, tell us quickly your inspiration about being, as a social media buff on the media, in the media world with your dentistry.
Okay, so I've been practicing dentistry for the past 18 years.
Okay.
And honestly, I was never ever on social media. I never even posted one picture
For 18
for
years.
18 years.
Sure. Okay.
And then when COVID started,
Mhm.
we were like fully geared in our outfits, and you couldn't even recognize who the dentist was.
Yeah,
So
true, true.
basically, when you walked into my rooms, you'd just see my eyes and
Yes.
you'd know, okay, maybe that's the dentist.
Yeah.
So I decided, let me have a whole turnaround.
Okay.
And I opened my social media page. And initially,
There's
I
a few.
said,
There's a few social media pages. Which one?
yeah, so my
Instagram,
dental
Face-
page, the Instagram
Instagram.
page.
Okay.
So my Instagram page is Dr. Fahima Isma.
Okay.
And initially I said, let me just post one picture about myself.
Okay.
So just introducing myself as the dentist and who the dentist actually is. So I posted the one picture, and later that day I said, let me just put a smile makeover, because my passion is smile makeovers.
Okay.
And I put some dental tips. And my patients were like, please carry on. We really, really love it.
Oh.
And it's so exciting and interesting to see who the person is behind the mask and who's actually treating us. And I love fashion and beauty as well.
Oh.
So I incorporated all of that.
Okay.
And that's how my dental page actually started. And it just grew from there.
Alhamdulillah, shukr.
Yeah.
So so COVID actually did something different for your practice.
Yes, most
after
definitely.
18 years.
Yeah, and I didn't really need it to promote my business as such, because after 16 years, I already
Established,
had
yeah.
my patients that used to come to me. But this just gave it an extra edge and something that I looked forward to, and my patients as well, and other
Alhamdulillah.
followers too.
Yeah, I know it's quite frightening going to a dentist. Now you have a dentist approaching you with full garb, not even recognize. Like you
Yes,
said, you
so
can't
it
even
was
see who the person
crazy,
is.
because as it is, people had the fear, like you said, and we really had to really protect ourselves.
Yeah.
So it was gloves, masks, not even one mask, double masks, and we used to wear the whole hazmat suits. So like I said, you think we are like out of space.
I know. I've got a cousin that's
Yeah.
practicing out in the UK, and we said, how do you keep even your? Because she's got
Yeah.
specs, and she's got goggles,
Yes.
and then she's got a mask, and then the mask covering, and then the
Yes,
full
so we had
hazmat.
like the
I couldn't
eyeglasses
believe
plus the
it.
face shield.
Sure.
And it was crazy. Like after
Okay.
each patient, you just needed a breather, you know.
What was it like being in that condition all day?
So that time was a really stressful time,
Mm.
and you would feel really claustrophobic and hot. It was really, really uncomfortable.
Yeah.
But dentists in general, whether it was COVID or not, we were always exposed to wearing gloves and masks.
Yes.
So for us, that was nothing
Yes,
new.
that's right.
It's just when COVID did come about, we took extra measures for
Okay.
us and our patients. And it was just the additional garments that we put on that
Okay.
made it a bit different.
Alhamdulillah. I'm so glad. Shukr,
Yeah.
alhamdulillah. And now we can't even, just thinking back, you just realize, did I go through that?
Yes, like thinking back, you think it was like really crazy, but
Yeah.
we still wear gloves and masks. Like I
Okay.
said, for dentists in general, we were always used to it. So for us, we'll always wear
So
it.
just a surgical mask.
Yes, just a
Okay.
surgical mask and your gloves.
Okay.
And yeah, just in general, that's what we need to wear.
Are you still practicing the whole, pandemic rules of sanitizing at your surgery, just to get the sort of an idea when people do visit?
So, like I said, with dentists in general, because I know my dad is a medical doctor, and they were never really as strict as what we were with regards
Before COVID?
Yes,
Okay.
before COVID.
Yeah.
And we were always used to sanitizing,
Okay.
disinfecting. So for
Okay.
us, it wasn't really anything new.
True.
It's just that we did add in extra measures, like maybe a UV light and the
Okay.
sanitizing solutions and that.
Okay.
But we were used to it.
All right. So let's talk post-COVID in the world of dentistry and what it's like now. Because of course now you don't need to do your hazmat. You hang that up
Yes.
behind the door, hopefully in the deep darkest
Yes.
corner of the closet.
Yeah.
So when people are coming to visit you now, are they meant to be wearing? Because we have a choice now whether we want to wear a mask or not. What is our protocol when going to visit a dentist, and has things gone back to normal?
Okay, so shukr alhamdulillah, things have gone back to
Okay.
normal.
Okay.
Initially, there was really a fear to even go to the dentist. And when COVID just started, people put off their dental visits completely.
Yeah.
So that actually was the safest time to come to the dentist because the COVID numbers weren't high at all.
And you guys were open.
And initially, we only opened for emergencies
Okay.
because there was also a fear amongst us
Yes.
whether we should treat patients or not.
Yes.
And like I said, that was the safest time because we were taking all the measures and the COVID numbers were really low. So there wasn't really anything to be scared about.
Okay.
And as time progressed, we realized as well that how long can you keep your doors closed? And if you have a toothache, you need the dentist immediately, you know?
Okay. Yeah.
So we started practicing and we just took the measures that we needed to and started seeing our patients. And then also on social media, we used to like just encourage people to come.
And you started
So-
your social media interaction
Yes.
a pandemic or like immediately during lockdown?
So mine was started immediately during lockdown.
okay.
So my followers and my patients were really engaged and focused, and they knew about the COVID updates.
And so you could interact with them, like to say, okay, you open now, or you close
Yes.
now, or
So it was really an exciting time for me because I built up a relationship with my patients,
Oh.
and they were so excited because anytime they would need advice or put their dental appointments on hold, they would just DM me and I'd respond to them as well.
I don't even know what DM means. I found out a couple of months ago. It's a
Yes.
direct message.
Yes.
Okay. I was still going to get used to that. So alhamdulillah, things are like back to normal or normalizing. Are people starting to visit the dentist?
Yes, most definitely.
yeah.
So I think like after at least 6 to 8 months,
Okay.
things already started normalizing and people were coming. And because you wore mask, so even if you had major dental work that needed to be done and kept on postponing it,
Yeah.
people were coming to do it because they
Yeah.
didn't have to show their teeth to anyone. So
A plus there.
they were actually happy that they could do their full mouth reconstructions.
Yeah.
And now they can actually show off their beautiful smiles.
And even till now, they can have a choice. I'm not
Yes.
just wearing it because it's of COVID. Don't
Yes.
want
So there
anybody to
was
see me.
pros and cons, and a lot of good also came out of it.
Alhamdulillah, alhamdulillah.
Yeah.
Okay, so let's understand how things are now post-COVID, because we know that people didn't necessarily take care of themselves the way they should have. Did that include their teeth as well?
Yeah,
During
most
the COVID, yeah.
definitely. So if you take a look, what happened during COVID is firstly amongst our kids, they became really lazy.
Okay.
So most of them weren't going to school. They just be couch potatoes at home, and they neglected their oral hygiene quite a bit. So they were so lazy to brush, and it was actually something their parents would have had to force them to
I'm
do.
not going anywhere. Nobody's going to see me.
Yes. So it
Everybody in the house
wasn't-
can smell my smelly breath. Eh?
Yeah, it wasn't only the kids, the
Yeah.
adults as well
Okay.
took it for granted because they weren't really going out into the workplace. They weren't going out. They were just at home, and they thought, okay, being at home, you
Don't
don't
brush
have
my
to
teeth.
really look after your teeth. And
Okay.
besides that, COVID also was a really stressful time for most people. So, be it financially, mentally, emotionally, it affected everyone in a different way. So, those actually, most people financially were really affected.
Strongly, okay.
And dentistry, as you know, is not a really cheap treatment to have
And
done.
it's by choice unless you're in pain.
Yes. So the
Until
thing
you're in
is,
pain.
most people couldn't afford dental treatment because they
Okay.
either lost jobs or they were struggling to come out, you know.
Absolutely.
So they put their dental treatment on hold. And another factor was that stress was really a contributing factor, which we now see the repercussions and the effects it had on your teeth.
Wow.
So, stress is a major factor with regards to teeth problems. Most people, they actually present with worn down teeth, TM joint problems, and cracked teeth, cavities. So, there's a whole host
Wow.
of problems that we
Very,
have
very
encountered.
interesting. That's very, very interesting. We need
Yeah.
to just take a quick break. When we come back, we'll
Okay.
chat more on this stress. Wow, I didn't even know stress can actually influence you having bad teeth, but more on post-COVID and the world of dentistry just after this. Stay with us. Assalamu alaikum. Welcome back. Good day wherever you are. Today we're chatting post-COVID in the world of dentistry. I don't even want to give an introduction because we're having so much fun talking about dentistry, and who knew that the dentist could be so much fun.
Yeah.
We have with us Dr. Fahima Ishmael. Assalamu alaikum and welcome back. Okay, so post-COVID and quite serious, knowing that stress affects your teeth. How is that? Please explain.
Okay, so a lot of patients that we encounter in our practices daily, we've noticed that they suffer from headaches, earaches, worn down teeth, pain in their jaws. And when we take a look at what's actually causing it, a lot of them are unconsciously in their sleep grinding their teeth and they're not aware of it. So, stress is a major factor. And like I said, post COVID, most of us were stressed. So unconsciously, we were actually grinding and we weren't aware, and we were actually damaging our teeth.
So grinding, when does it happen? Only when you sleep?
So it happens mostly when you sleep,
Okay.
but even when during the day, it could happen if you're overworked. Something can trigger it, and you still just start clenching your jaw. So everything goes like into a spasm, and your muscles and joints get tightened. And we see the effects when you present to us at our rooms.
Okay, so what are the effects of grinding your teeth and
So, the
stress?
effects of grinding, you'll actually see that your teeth start wearing down.
Okay.
So, the surfaces of your teeth start flattening out. If you had fillings in there, they don't last so long. And also, you start getting pain in your joints. You get a clicking sound when you open very
You're
wide.
pain in your joints in your mouth.
Yes.
Across
So,
your face.
over here, you'll see this is the TM joint.
Okay.
So, if you open your mouth really wide, you actually notice that you start hearing a click when you open your mouth really wide.
Okay.
And when we notice that clicking, that's actually a sign that you have been grinding. And these joints go under so much of stress, and the muscles are going under stress as well. So that's all the contributing factors.
Sure. But you've mentioned
Yeah.
other things earlier before the break. I can't even
Yes.
remember what the words were. But you
Yeah.
said there are other conditions where your teeth gets affected and it's stress. You said the grinding, the
Yeah.
TMJ. What
So
else
the
was it?
thing is that so you'll hear a word called bruxism, which is grinding your teeth,
Okay.
and that so you see the ears, neck, and mouth are all related. So even though we dentists, we deal with this entire area.
Okay.
And that's
Bruxism.
why when you grind, it affects the joints and you can also get headaches.
Does this happen to everybody? I mean, young teenagers up
It
until
can happen young
the
or
older granny.
old.
Okay.
And previously, we didn't see a lot of these cases. But like I said, post COVID, you're
COVID.
seeing more and more
Okay.
cases presenting.
What else? What else was common post COVID?
So,
Because
common post COVID was also mouth ulcers. So,
okay,
stress is also a contributory factor on
of
mouth
mouth ulcers.
ulcers.
Okay.
And we also saw that there was a lot of cavities that patients presented
Of
with
course. Yeah.
because obviously they've been neglecting their oral hygiene.
Mm.
So, there were numerous things that we needed to deal with post COVID.
Were people ready to come and visit the
So, you
dentist
see,
because
the
of their
thing
problems?
a lot of the times people are afraid to
Yeah.
come to the dentist,
Yeah.
and they also think that we're going to charge them. There's a stigma attached to this.
Mm.
And all I can say is don't be afraid of the dentist. We're there to actually help you, and we're there for you. We see different cases daily.
Mm.
So even though you might think yours is like the really worst case, we've seen worse than
Worse.
that.
Okay.
So don't worry, you can always make a start. It's never too late, but make a start.
I believe you are called Dr. Fahima Ishmael because you make people smile. They come there to fix their smiles.
Yes.
And which I forgot to mention that we're going to have a competition. We're running a competition at the end of the show. So please stay with us. Dr. Fahima is doing a great giveaway to the plus minus of 1,000 Rand. So please stay with us right up until the end of the show, because if you're not, you're going to miss out on the questions and what you can look forward to her giveaway. Your practice, is it called Dr. Fahima Ishmael?
Yes.
Okay. So you Google her, but we'll also leave the details below. So bruxism, you said, is grinding, because we know it as grinding. This is a new terminology for me. Okay. I was just Googling and just randomly reading about dentistry now since just before our interview, and I came up and discovered there's something called dental anxiety. Could you tell us a bit about that, seeing that you're linking, people fearing coming to the dentist, being judged? Because
Yes.
we don't say that.
Yeah.
I'm so glad that you know that. So I know people that actually don't go to the dentist at all.
Yeah.
I think because of that underlying reason.
So that's why recently I've launched the We Care for Oral Health campaign in Africa,
Oh,
where
wow.
I go in my spare time and educate and empower kids all over the country. And weekly, I get invited to different schools to actually
brilliant.
educate our children. So tomorrow, I'm actually going to a school for the disabled children, and I'm
Wow.
looking really forward to that. And my whole aim is to break that fear that was always instilled in people in general. And I think it stems from when we're young.
Okay.
So many years ago, if you went to the dentist, they might have just extracted your tooth.
Yeah.
And people are still under
Take it
that
out.
notion that's what
Yeah.
the dentist is going to do. If I go to the dentist, they're going to pull my tooth out, and I'm going to be in so much
Pain.
of pain. But what I would like to say is we need to break that fear.
Yeah.
And it starts from when you're small. So, as a parent, we need to start educating our kids, and we need to start making it a wonderful experience for
Yeah.
our children and make it a family visit. I have so many people coming to my practice with their families.
Yeah.
So say like on a Saturday, if they not working, they'll come as a family, and even if there's nothing wrong with their teeth, just so that their
Everybody
kids also get
comfortable.
used to coming to the dentist. So it comes from when you're a child, and once we start breaking that fear, it becomes part of your routine. And you know that every 6 months you need to visit the dentist.
Okay.
So when you come to your teenage years, adult years, it's basically maintenance. And most people present to the dentist when it's too late. So either they're in dental pain and they already have an infection and they think maybe we're causing the pain. So the first thing most
They come there
patients,
with pain.
yeah, so the
Yeah.
first thing when they sit on my chair is we're scared of the dentist or we don't like dentists. We like you, but we don't like the dentist. So I just try to calm them down, and I've actually um, had a different approach to dealing now with my
Okay.
patients, where I've learned over the years you have to really listen to what they have to say,
Okay.
be more compassionate, be friendly, and you need to interact a lot with your patients so they're comfortable.
So you're not just a
Yeah.
dentist, you're a therapist as well. They can't talk with their
Yes.
mouths open.
And that's why, like
So
with
you
my
have to do the
social media
talking. Yeah.
page,
Okay.
when they look, so with my page, I don't only put dental pictures
Okay.
because most of my followers, even I did a survey, they said we don't only want to see teeth. So we want to see the other aspects that you do. So I do a lot of charity work, the school visits. And like I said, I do like fashion, beauty, and everything. So I incorporate everything on my page.
Wow.
So if you look at
A
my
dentist with a
Instagram page,
difference.
yeah, so you won't just see like teeth
Okay.
pictures. And I think that's what makes people more comfortable
Yeah.
coming to the dentist because before they enter my rooms, they know what to expect, who to
Mm.
meet, and my personality as well.
So would you say that the approach of advertising your services, like 'cause
Yeah,
some dentists do, I've seen, we specialize in children dentistry, in
right.
pediatrics. We make you comfortable, or
Yeah.
bring the family. Do you think that's important to know that about your dentist? And
Yes.
like, also, how do you choose your dentist then when it comes to that?
I think that is important because you need to know what your dentist has a passion in.
Hmm.
Like, for example, myself, I love kids. Kids are my passion, and I love creating smile makeovers. So, patients that generally come, they know this is what they're looking for, this is what they want in the dentist, and
Okay.
what they want from the dentist. So, it does make a
So
difference.
instead of saying, "Oh no, I'm coming for an extraction or
Yes.
to fix some pain," you're coming for a smile
Yeah.
makeover. That's a much better approach. Okay, but does it still happen that people that you actually, when you go to the dentist, do they try and save your teeth, or is it just like, we need to pull this out?
Okay, so my approach, and I think most dentists nowadays,
Mm,
is you need to try and first save the tooth.
okay,
And if unfortunately we can't save it, then we would introduce other options to you. And unfortunately, then we would have to take the tooth
okay.
out.
Talk to me
Yeah.
about saving the tooth, because
Yeah.
I thought this was a joke, or it was an old wives' tale,
Yes.
but this is a dentist telling me.
Yes.
A very good friend of mine is a dentist in Cape Town, and she
Right.
said to me she lost a tooth when
Yeah.
she was pregnant.
Okay.
I thought she was joking, and
Yeah.
she says, because you hear that, you gain a child, lose a tooth.
Yes.
I didn't know what that meant until she told me the story.
Right.
I couldn't believe it. I mean, I didn't even question her back and forth. I thought it was a joke, rubbed it off. But what do you do in that case when somebody's knocked out your tooth, or
Yeah.
you have a chip, or the tooth comes out?
Yes.
Do you save the tooth? Tell
Yeah, so
us.
it just depends how early you've actually presented to your dentist if you
Okay.
did have that scenario. And if your tooth is something that we can save, so if it
Mm,
has come out or whatever, if it's in the right time frame and if it's in the right condition, we can still save it and we
okay.
splint it, implant it back into the mouth. And besides that, even if you do have any infections or whatever, we would first try to do root canal before we actually take the tooth out.
That's the one word that nobody wants to hear going to the dentist.
Yeah.
We're going to find out exactly what a root canal is.
Yeah.
And is it really such a scary, horrible, terrible word after all? And as I said earlier on, we have some giveaways at the end of the show. So please stay with us. We're going to take a short break. Back in a moment. Assalamu alaikum wa rahmatullahi wa barakatuh. Very good day to you. Welcome back. Hope you are well wherever you are and your teeth is good as well. If not, it's time to go and visit the dentist. Post COVID, guys, your dentist is waiting for you. We are chatting to Dr. Fahima Ismail, who says she'll give you a smile makeover. That's her motto. So she's not going to fix your teeth, and she's not going to you're not going there for pain. Don't don't let that come anywhere close, because that's the first thing people think of. And then also watch out a little bit later on, closer to the end of the show, we're running a competition, so stay tuned for that. Okay, Dr. Fahima, you brought up the word root
Root
canal.
canal.
And that's
Yeah.
the worst anybody wants. I don't know why people are so scared.
Okay,
Please
so
tell
people
me.
just have this notion that root canal is something to be afraid of.
Okay.
And they're like, we don't want to do a root canal. We're going to be in so much of pain.
Mm.
But I just tell them, don't listen to anybody's stories and don't Google.
Follow
We
Dr.
hate-
Fahima. She will tell you.
We
Okay.
hate the Dr. Googles
Okay.
because that's the worst thing you can ever do.
Mm.
So root canal in general is not a painful procedure.
Okay.
But
the needle going
it
into your
is
gum.
when we actually have to. So when the caries reaches the nerve of your tooth, then unfortunately a general
what is
filling,
caries, you said?
a cavity in your tooth.
Okay.
Yeah. So when that reaches the nerve of your tooth, we can't really just put a filling for you because we need to remove the nerve so that your tooth actually becomes dead. Okay. So patients only feel pain when they have an active infection and it presents with an abscess on their gum, and we actually need to drain out that infection to relieve them of the pain, right? So like I said, if you make sure you come every 6 months to the dentist and you go for your regular checkups, and that you don't need to present at that very late stage when you're in so much of pain. Other patients of mine that have done root canals haven't felt anything at all.
You lie.
So
you're lying.
it's just dependent on the tooth that we're working on and what stage of infection it is at.
I've never had a root canal, so I can't say.
Just go in with an open mind. Trust your dentist. Listen to your dentist. Like I said, we speak to you through the procedure.
Take some anxiety meds before.
It's not a bad thing at all. If you can first do the root canal, try to do that first to try and save your tooth. If not, then we would remove your tooth.
All right. So cavities and abscess and I think general, we want to talk about that maybe that a little bit later after caring for your teeth, but let's just establish, how do you even get an abscess?
Okay, so you can get two types of abscess, which is one on the gum. So that could just be due to poor oral hygiene and if you don't clean properly at home.
What is poor? Let's just put it out there. What is poor oral hygiene?
So poor oral hygiene in general is your daily home routine that you're supposed to be doing daily. So in general,
and I'm sure we've heard this before, but let's just do this again.
So you need to make sure twice a day you need to brush, and most patients at night, they skip the brushing. And little do they realize the night brushing is the most important, right? So if you don't do your twice a day brushing, your mouthwash, and at least once a day to floss, which most people don't floss, they hate flossing, we generally end up with a gum infection, right? And if you don't go every 6 months to your dentist for a cleanup, because at home, all the plaque can't come out of the toothbrush, so you need to do a nice clean and polish at your dentist. So that eventually leads to a gum infection, and you can...
So poor oral hygiene is not when they're brushing...
visiting your dentist every 6 months.
Visiting dentist every 6 months, but your daily routine is your brushing, mouthwash, and flossing, morning and night.
So every day you need to do that.
All right. Twice a day, guys.
If you're going to neglect that, and if you're going to neglect the every 6 month cleanup, you're going to end up with a dental infection.
Why do this every 6 months? Why
so every
is
6 months you need to, because with a toothbrush, just the surface plaque and bacteria tends to come out. But between your gum and your tooth, plaque goes underneath and you cannot take it out of the toothbrush.
Under your tooth by your gums?
So we use a special instrument and a machine, which is called a scaler. Where we can access between your gum and your tooth and remove all that material that's stuck. Because eventually what happens is the plaque, which is the bacteria, and it hardens
I'm sorry.
around your tooth surface, okay? So when it hardens, it forms like a cement layer over your
Oh,
teeth.
what?
And like people think, okay, now my teeth are feeling nice and smooth at the back. And actually,
Yes.
that's a cement layer formed by the plaque, which is called
Okay.
calculus, right? So that cement layer, as it goes underneath the gum, the bone support of your tooth gets lost. So that's why every 6 months with the machine, we need to remove the plaque and calculus
Ki-
so that you don't end up with a gum infection and you don't end up with bone loss.
This is not something you can do at home with a machine with
No.
a spray,
Not at
squirty,
all.
water
That's why
stuff.
you need to visit
Okay.
the. And then when you come in for a clean and polish, all of a sudden you'll say, "But my teeth feel so rough at the back, and I can feel all the gaps."
Yes.
But that's actually how your teeth should
So,
feel,
so stupid.
because all the plaque was making your teeth feel like it's smooth at the back, but it was actually cementing all the bacteria around your teeth.
I don't. Okay.
Yeah.
Thank you for explaining all of that. And all of a sudden, my tongue's going around my teeth just to check. So okay. So you brushing your teeth every day. So
Yeah.
maybe do it
It's
3 times.
not sufficient.
That's still not enough.
It's not
Yeah.
sufficient.
Okay.
Yeah.
I just wanted to establish that. Okay.
So
let's
that's
move.
why when I go to the schools, I always educate them, even
Mm.
if you don't have a hole in your tooth or a cavity,
Yeah.
you still need to visit your dentist just for your routine cleanup and your checkup. Because when you go every 6 months, the dentist also has a look. Is there any cavities? Has any of your old fillings
Yeah.
started leaking? Because you can get decay underneath your fillings.
Oh.
So we need to check all of that
Okay.
to make
So
sure.
tell me quickly the oral hygienist. I know we still haven't finished root canal
Right?
yet, but
Yeah.
we're going to get there. It's a long procedure.
Yes.
The oral hygienist. What is the role of the oral hygienist then? If you want to just do a polish or clean. just
Okay,
to
so the
clean up.
oral hygienists, they can do cleaning and polishing
Okay.
and teach you how to look after your oral hygiene.
Okay.
So a lot of dentists have oral hygienists in their practice.
Okay.
So they actually encourage patients on their routine clean and polish.
So what would you say is the necessity then to see the dentist or the oral hygienist?
Okay, so you see, the oral hygienist is just for your clean and polish,
Okay.
but the dentist needs to check whether you need any fillings, root canals, extractions. So there's certain procedures which dentists can do,
Mhm.
but oral hygienists cannot do.
So when it
Yeah.
comes to the oral hygienist, at what point would she then or he then
So the
refer you
oral
to the
hygienist,
dentist?
they could do like just basic fillings.
Okay, so they do
That's not,
fillings.
but it's very, very small fillings that they're
Okay.
allowed to do.
Mhm.
Anything bigger, they would have to refer you
And then
to
they
the
would advise
dentist.
you. They
Yeah.
would actually tell
So
you.
they would do mainly like fissure sealants, which we do in kids, and that's to prevent cavities from getting bigger than what they are, or preventing cavities from forming.
Mhm.
And usually on your molar teeth, they put fissure sealants, it's called, to protect your teeth. And like I said, your clean and
Is that
polish,
still
they
their
can do.
permanent teeth or their milk teeth? We're talking
They're
about little
permanent
kids?
teeth.
Okay, they're
Yeah.
permanent. Okay.
And yeah, so they could do that.
Wow. Okay. Let's
Yeah.
get back quickly to the root canal. We know that you said it's not painful, it's just a little bit of a sting. And it's actually done to save the tooth.
Yes.
So how effective is that root canal then?
So root canal is not permanent. Nothing is permanent. It just prolongs the lifespan of your tooth.
Okay.
So, say for example, you had a dental infection and you took out your tooth.
Mm.
So, you would have lost your tooth. With the root canal, it would give you at least a few more years.
Okay.
Although not all root canal treatments are successful, some do fail. And the first line of treatment is always to try and save the tooth first. Unfortunately, even after the root canal, if the treatment isn't successful, then we would have to take your tooth out.
Okay. So how long does a root canal take?
Root canal, it depends which tooth we're working on.
Mhm.
If it's the front tooth, sometimes we could do it in one appointment, but most cases, 2 appointments or 3.
That's the scary part
Yeah.
because
But normally, if there is any pain that you're going to feel, it would be at your first visit.
Okay.
After that, generally, the pain should get less. And after that, nothing at all.
So
Yeah.
where does the pain come from? It's associated with the nerve, of
Okay,
course.
so you see, because in any, you might have had a dental abscess, so it's
Mm-hmm.
accumulation of pus in that area. So what happens is when we start opening up the tooth to do the root canal, because the pressure is being released because of the pus that has accumulated there, you feel that intense pressure,
Pressure.
and
Okay.
that's what actually causes the pain.
Ooh, okay.
Yeah.
So, the local anesthetic that you use is done, that's literally the only pain you'll feel that the dentist is going to give because of the pinch of the needle.
Yeah.
And then how long does that last because you're wanting to have effect still after the root canal because of the pain?
Yeah, usually the numbness lasts at least 2 to 3 hours.
Okay.
So patients sometimes think after 5, 10 minutes, now we're no longer numb in that. But
Mm,
when we do numb you, we make sure we do it properly.
okay.
And like I said, it lasts at least for 3 hours.
All right. We're going to get back to more post-COVID questions just after the short break. Stay with us. Don't forget to catch us in the next segment for our competition. Back in a moment. Assalamu alaikum wa rahmatullah. Very good evening. Welcome back to Post COVID in the World of Dentistry. We have Dr. Fahima Ismail with us, who is going to make you smile at the end of the day. Don't be afraid. We chatted about quite a few things post COVID, but there's so much more that has come up: crowns, bridges, gingivitis, milk teeth, elderlies. Our everyday routine. So, definitely we'll have a follow up. And don't forget, at the end of the show, we're running a competition. So, do stay tuned. Okay, Dr. Fahima, let's quickly get to your toothpaste. Your toothpaste with your dental, your daily oral hygiene health comes your toothbrush, your toothpaste, your miswak, your floss, your mouthwash. Gosh, that's a lot of dental care.
Yeah.
Yeah, what else? So,
Okay.
how do you choose and when do you change and how do you know which is the right one for you?
Okay, so like you say, it's a lot of care, but your mouth, although it's such a small entity, it impacts on your whole body,
Yeah.
right? So we need to look after it. And like we know, cleanliness is half of Iman, and we must make sure that we look after our teeth, whether we like it or not. So going back to many, many years ago, the miswak was the very, very first thing that we used for cleaning our teeth, and up till today it still stands, right?
Alhamdulillah.
But because of our diet that has changed so much, in addition to the miswak, which we use daily,
Mhm.
we should actually incorporate a toothbrush with a toothpaste,
Okay.
right? So our toothbrush in general should be medium to soft. We shouldn't use a very hard toothbrush and neither too soft as well. Because when you brush, you want it to feel nice when you're brushing. So most people, they feel the harder your brush, the better it is,
I
and the
was just going to
harder.
ask, why do they sell hard
Yes,
toothpaste?
and the harder I brush, the
Yeah.
better I'm going to actually clean my teeth.
Okay.
Where in actual fact, you are damaging your gums and the
Mm,
health of your teeth, right?
okay.
So, generally, just some advice is choose a medium to soft brush,
Mhm.
which is not so harsh on your gums and your teeth. And the correct brushing technique is also important. So most people would just brush in this direction and this, and they think they're brushing well and everything is
30
good.
seconds, it's over.
Yeah, but in
Yeah.
actual fact, we need to brush in circular motions
Okay.
with a medium to soft brush. Our toothpaste needs to have fluoride in it, which gives us extra protection against the bacteria and cavities forming in our mouth,
Mhm.
and it strengthens our teeth as well. So that's your basic, which every household should be using. Kids should use age appropriate toothbrushes and toothpaste at
What is
least.
age appropriate?
So, say from 0 to 6 years,
Okay.
you'll see there is toothbrushes and toothpaste specifically for those
Wow.
age groups. And then once you reach over 6 years, you could start using the kids' toothbrush and then the adults' toothbrushes. And your floss also, you get your general flossing, which we get in the containers, right? But most people, like I said, are lazy to floss. So now you do get the water flosses as well, which are not as effective as the
No, they're not.
conventional
Yeah.
floss, but at least it's something. It's better than nothing at all. And
Sorry.
your mouthwash also. So, like the dental mouthwash, Listerine,
Yeah.
Colgate, you need to start using
What
that.
should be in the mouthwash?
The mouthwash, there's not anything specific, but like even if you're not using a mouthwash, even warm water and salt,
Okay.
which most households can afford.
Yeah.
Because some people think it's so expensive. By the time I buy my mouthwash, toothpaste, floss, it's quite costly. So even if you just use warm water and salt to rinse daily, it also forms like an antiseptic barrier for your teeth in
I've
general.
also heard about oil pulling.
Yeah.
And they talk about swishing coconut
Yeah,
oil
but
or something
generally
like that.
just use warm water and salt,
Okay.
and that's effective. But you must make sure twice a day you use your toothbrush and toothpaste.
Okay, so you're doing
So
all of that.
that's-
Is there a
yeah.
specific time? Can you just do it in 10 seconds, 30 seconds? But you're saying
At
do oral.
at least a minute or two you should
Okay.
be spending on brushing your teeth.
Just the brushing?
Yes, just the
Okay.
brushing, and then the mouthwash would take you like about 10 seconds or
Okay.
so.
Okay.
And the flossing,
Just to get
once you get
everything out.
used to it,
Yeah.
it would take you less than a minute, honestly.
It's actually quite addictive once you have, because you get these flossing sticks.
Yes, so you
that
get
has
that
like
as well.
a
So
shape.
once you start flossing, you'll see the days when you don't floss.
Yeah.
You'll actually feel so terrible that you should have flossed.
Yeah.
And generally, every 3 months, you should be changing your toothbrush.
3 months?
Every 3
I thought it was
months.
6 months.
Every 3 months, you
Okay.
should be changing your toothbrush.
I miss those days when the dentist used to visit us at school and give us free
Yes.
toothbrushes.
And especially if
Yeah.
you were sick and you had COVID or you had the flu,
Okay.
you should replace your brush as well, because the
Oh.
bacteria that is on the toothbrush. So you should be having a new toothbrush, and no
Every 3
sharing
months.
toothbrushes.
I don't know anybody who does that.
So you'll be
Oh,
surprised,
really?
because a lot of school visits I went to, and the kids are so innocent and they speak the truth. So a few of them did say, no, we share with my mommy or we share with my daddy. But I said, no more sharing toothbrushes. But
I was going to ask you earlier on,
Yeah.
what are these visits like? Is there anything
I just
funny?
love it. It's so nice, and it's so like encouraging and heartwarming.
Yeah.
And just
Because
to
you're a dentist, so
interact.
they're afraid of you, of
Yes.
course. How do they?
So, and when I enter there, they're like, no, you're not the dentist.
Okay.
Yeah. So
You don't look
then-
like a
Yeah.
dentist.
But like I said, it's so nice to interact with the kids and also get their opinions and just a feel of
The
what
simple
they
truth,
feel
yeah.
about the dentist and going to the dentist.
Okay.
And most of them haven't even been to the dentist. So after I've given them that whole oral health talk, they actually
wanna
look
visit.
forward to it, and they
Oh.
want to visit the
Oh,
dentist.
brilliant, man.
Yeah.
Okay, so alhamdulillah, there's so much that is said post-COVID, and I'm sure we haven't even hit the tip of the iceberg when it comes to looking after your
Yes.
teeth and the conditions, inshallah, which means you're going to have to come back for a follow-up show. But tell us quickly, with regards to the elderly viewers, a lot of them, and even the younger ones, sometimes they suffer from chronic conditions, and I've heard that bad oral health attributes to your condition, and it
Yes.
actually makes it worse. You have to look after it. How true is that? And also just some advice to the elderly viewers of how they can look after their teeth as well. Do
So
they
there's a
need
lot
extra
of
care?
elderly, and as you say, nowadays the younger ones also that
Yeah.
are having to deal with chronic sicknesses that they're going through, and most of them are put on chronic medications, and these actually affect your oral health, because either you could be having decreased salivary flow in your mouth can be dry, you get more cavities, bleeding gums. So the medications can contribute to that. It can be the sickness that you're actually suffering from, and that can all have an impact on your oral hygiene as well. So what I would suggest is, whether you're young, old, visit your dentist, inform them, and it's really, really important that you inform your dentist what medication you're taking, what medical illnesses you have, because it all affects your dental treatment as well. And then your dentist can advise you on how to look after your teeth. Also, some patients suffer from arthritis or have disabilities, and they feel it very difficult to actually brush their teeth. And we have things that they could use to give you extra strength for the teeth itself,
Okay,
and prevent cavities from forming also.
Yeah, so that also comes up for me. Are there anything extra that we can do besides our daily good oral health care in our lifestyle, in our diet? How else can we care for our teeth?
So in most cases, besides your daily regimen that we just discussed earlier, your diet is really important.
Okay.
So most of us eat a lot of sugary things and
Mm.
snack a lot in between, but on the unhealthy foods and also the drinks that we have. So that also plays a significant role in our oral hygiene and also the cavities that form in our teeth. So ideally, if you just maintain your home routine, you have a proper diet, and from young, also like for your kids' lunch boxes and that,
Okay.
don't put cold drinks or
Sugary
juices.
drinks, fizzy
And
drinks.
also
Yeah.
when you're packing their lunchbox, try to avoid the very sugary stuffs.
Mm.
So if you just follow that simple thing, you don't actually need extra measures to combat, bad oral hygiene. Because I know when we were really small, they said you need to take fluoride tablets and all of
Mm.
that. But generally, if you just follow the rules that we've
And
mentioned,
drink lots of
you
milk and all
don't
of that
really
stuff.
need all
Okay.
of that.
All right. So there's no
Yeah.
extra calcium that you
But
need to
we
take.
do sell certain products in our surgery
Okay.
for those that are really prone to decay
Okay.
or have very sensitive teeth. So we
Okay.
can introduce you to those products and they work really well.
So that's
So
more things to talk about.
yeah,
Sensitive
but
teeth.
if we feel you need it,
Okay.
then we would recommend it. But in general, most patients don't need it.
All right.
Yeah.
So our time is almost up and we still need to get to the
Oh.
competition, the exciting bit, which we literally just came up with. Because
Yes.
I'm so happy and very excited about having you in studio. And I think our viewers are as well, and they want to get to know you more. So we are very excited to hear that you will be offering one of our viewers,
Yeah.
a prize through the social media platform. But there is a quick question that they have to answer. What is that, Dr. Fahima?
So that is, what is the dental term for grinding your teeth?
Oh, I've got it already.
Yeah.
Very important, hey?
Yes.
So you got to Google that, and what would be the rules of the competition? How do they enter the
Okay,
competition?
so basically, I'll post it on my page, my
Okay.
Instagram page. So they need to tag myself, Hilaal TV, and Hilaal Sales and Marketing.
Okay.
So all three accounts need to be tagged.
With your answer,
And with the answer,
do they have
we'll
to give
run the
their...
competition, I think, till the end of the week.
Okay.
And then Monday, we can announce the winner.
Okay.
And they need to tag at least 3 other people.
Okay, to
Yeah,
follow,
to follow.
follow these.
So they need to follow
accounts.
all 3 accounts.
Okay.
So the winner would have had to follow all 3 accounts, but they should tag us,
Dr. Fahima Ishmael,
Hilaal TV, and Hilaal Sales and Marketing, and 3 other friends.
And 3 other friends they've got to
Yes.
tag in.
Yeah.
Okay, the question, what is the term
Dental
for
term for
the
grinding.
dental term for grinding? I think
Yeah.
it starts with a B, or is it D? I'm not sure. I forgot it already.
So the dental prize would be
yes,
worth
yes.
1,000
Okay, that's the
rand.
big
So it's a cleaning and polishing and a whitening toothpaste worth 1,000 rand.
brilliant stuff. I want
Yeah.
that. Okay, so remember, the competition is open to everyone except employees and staff and everybody associated to Hilaal TV, unfortunately.
Yeah.
And then, of course, to all your followers, to all our followers and sales and marketing followers, they
Yes.
tag you in, they tag Hilaal TV and sales and marketing and answer the question. Do they have to give their name or contact details, or will they just be contacted via their page?
Yes, I'll
Okay.
just contact them. And like I said, we'll announce the winners on Monday. And it will be valid only till the end of
End of the month.
October.
Okay, great
Yeah.
stuff. Thank you so much, Dr. Fahima Ishmael. Definitely going to have you back soon, inshallah. Very excited about our follow-up show because this is something that I really enjoy, my teeth.
Yeah,
And I
thanks for
love-
having me on your show.
And
and
I hope...
there's so much more to talk about. We can never
Absolutely.
do it on one show.
Absolutely.
Yeah.
It was a pleasure having you on air with us. Definitely we'll hope to see you soon and keep all your patients smiling, inshallah.
Thank you.
Assalamu alaikum. wa
Alaikum
rahmatullah.
salam.
So there we have it, Dr. Fahima Ishmael, our dentist, talking to us about post-COVID in the world of dentistry. Don't forget the competition running for Dr. Fahima Ishmael. Tag her in. She will run the necessary details. Follow the details on the screen, and you can tag in Hilaal TV, Hilaal Sales and Marketing, and answer the question, what is the dental term for dental grinding your teeth? That is the answer to the question. That is the question. Please send your answers to those various social pages. But for now, next week, we stay tuned. We hope to see you back next week again, and stay tuned for a great show on health and wellness on Hilaal TVT. For myself, wassalamu alaikum, and goodbye for now.